Hi, I'm Dr. Usha Kiran. I'm a consultant obstetrician and gynecologist. Whether to remove your cervix or not is a question you need answering if you're planning to have a hysterectomy, that's removal of the womb. When we remove the cervix at the time of the surgery, it's called a total hysterectomy, where we've removed the body of the uterus, that's the cervix. If we leave the cervix and remove only the body of the uterus, then it's called a subtotal hysterectomy. Now, you might not always have a choice to choose between the two of them. If the cervix already has a problem, like a fibroid or a tumor or cancer, or if you've had previously abnormal smears, you will not be allowed to keep the cervix. You will have to have a total hysterectomy. But if your cervix was normal, no problems with it, all your smears have been normal, then you do have a choice to keep your cervix. Now, what happens during a total and a subtotal hysterectomy? In a total hysterectomy, where we are taking the cervix out, we make a cut on the vagina to separate the cervix and the uterus. So there is a scar in the vagina, which you can't actually see it, but it's there inside. When we do a subtotal hysterectomy, where we are leaving the cervix behind, we make a cut between the cervix and the body of the uterus. So there is no scarring which is actually in the vagina. The scar is in the cervix, which is inside your abdomen. Now, there isn't any strong evidence to say that keeping the cervix makes a huge difference. However, some are of the opinion that when you keep the cervix and when you don't cut the vagina, you have kept the vaginal anatomy and structure as it was before. Hence, your sexual, bowel and urinary functions will remain the same as before, unlike somebody who might have a total hysterectomy and they might find a difference. There isn't enough evidence to say this, but yes, it is possible and it's perceived by some. However, if you do decide to keep your cervix, you've got to be aware that this cervix can in future give rise to problems, including cancer, which might require removal. Now, if you decide to keep the cervix, because of this reason, you need to continue to have your pap smears every 3 yearly till the age of 65. As long as you are aware of these pros and cons and risks and benefits of keeping or taking the cervix out, you can make a well-informed decision at the time of the surgery. Kindly check the information part of this video for a link to my blog, Dr. Usha Kiran, blogspot.com, and the Facebook link. And you can contact me on my WhatsApp number 0091 720 801 2411 for any further queries.